Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande from Pune, Maharashtra State, India. As you know, I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. Today's our class is regarding the Kaumarbhritya tantra or the Balarog, or in the modern science it is called as a pediatrics. But we will focus both Ayurvedic pediatric science and the modern pediatric science. Today's topics are Navajat Shishu Poshan or infant feeding. So I request all my students who are in front of me that they can open their notebooks first. Please write down the serial number of the lecture. It may be the fifth lecture or the sixth lecture of the Kaumarbhritya Tantra. Write down the date, please. That is the 1st of November 2023, and give this title Navajat. Even you can write down in the Devanagari script. That can be the best practice, because Ayurvedic words, if you try to remember in the Devanagari also, that is also good for you. Navajat Shishu Poshan or infant feeding. This is the proper title. And subtopics that we are going to discuss, just I will scroll down and then we will discuss one by one. We will first discuss about Ayurveda. Okay, what they are talking in Ayurveda, what should be given on the first day to the newborn baby, on the second day, on the third day, on the fourth day. Then we will see about the contraindications of stanyapan. Breast milk should not be given. Why? When? Then we will talk about the modern science and what is recommendation by World Health Organization or UNICEF. What they are talking about the infant feeding, that we will see. Then the duration, time schedule, quantity, etc. And then again we will come back to the Ayurvedic aspect of stanya pana vidhi. Stana means breast, and stanya is a breast milk. Stanya, breast milk. So there is a typical posture how that particular feeding should be done. Actually, this training is given now not only in the foreign countries, but India also. In the various gynecologist hospital, they train the pregnant woman after delivery how she should take care of the newborn baby, how she should feed that particular breast milk to the newborn baby. All the training is already given, so that we will see. Then stana sampat, what is the quality of their breast and breast milk. Then we will also talk about the technique of the breastfeeding. We will see some figures and the positions, and then we will see the advantages of the breastfeeding. That is most important for the mother as well as for the baby. And then we will talk about, as the time permits, stanyotpatti and the stanya pravrutti. Then we will see also the stanya pravrutti, how it happens. And then we will see the good, nice breast milk and what is the problem with the breast milk and how we can test that particular breast milk. So this is, in general, today's topic is regarding the feeding of the Navajat Shishu or the newly born baby. So step by step, we will, as usual, we will mark the portion and we will try to understand that particular topic. Adequate nutrition for the newborn child is a fundamental for healthy life. That means in the beginning of life, if that she or he, that baby, gets a proper nourishment, then only the development of all the dhatus, rasa, rakta, maus, med, asti, manja, shukra, is possible. So there is a nourishment to all the dhatus. We have to take care. Muscles are developing, brain is developing, intelligence is developing, motor activities are developing, hearing and auditory speech is also developing. But for this development of the milestones, it is called as, please write down this word, M-I-L-E, milestones, S-T-O-N-E-S, milestones. I have already 6 videos on the YouTube in the Kaumarbhritya or the pediatric class. That is the name of the playlist. Please check all the 6 videos that I have done previously, and there I have explained what is meant by milestones. That means in the 6th month, the child should start the scrolling, and then which month he should sit, which month he should stand, which month he should speak syllabi like baba, mama, kaka, which year he should complete sentence he should utter. So this is called as a milestone, development of the baby. But for that development, you need the proper nutrition. For the first 6 months, please this period is write down. Minimum 6 months is equal to breast milk. The best food for the baby is breast milk, stanya in Ayurveda. The growth and development of an individual, that means baby, is directly proportional to the type of the nutrition that the baby receives. If he is having the problem, not breast milk is there or the nutrition is not proper, then there may be vitamin deficiencies. There may be iron deficiency. So the child will suffer from anemia. Child will suffer from rickets. Child will suffer from marasmus. So these are the nutritional diseases. The rate of growth and development is faster in infant until 6th month of age. Height and weight, both are increasing rapidly. So first 6 months are very important. Therefore, the source of nutrition should be adequate, both by quantity and by quality, taking care of the digestion by that baby and absorption capacity of that particular child. The ideal source for a newborn, please write down the best source. I will wait. Best source is a breast milk for the first 6 months. Ayurveda has explained, especially Charak or Kashyap, the avastha are like Kshirad. I will wait. Please write down. Kshirda. Kshirad. That is only milk is a predominant food. Then from 6th month to the 2 years, please write down up to the 2 years, Kshiranad. Kshira, Kshiranad, double N-A-D. Kshira plus Annad. There is a milk as well as some external food. And after 2 years, more Annad. So these are the important stages of the development that Charak has mentioned. Kshirad, Kshiranad, and Annad. Are you getting my point? Okay. Specific feeding schedule by the Ayurveda. Let us see how we can move this particular cursor over here. Okay, fine. Specific feeding schedule. I will mark that. Focus on the topic. Only Acharya Charak has stated to initiate breastfeeding to the newborn on the first day, soon after Madhu. What is Madhu? Honey. Sarpi, that is ghee. Prashana during Jat Matra Sanskar. Jat Matra Sanskar. Acharya Sushrut and Vagbhat have mentioned that the actual establishment of lactation, that means breastfeeding, starts only after 3 days of delivery. Hence, breastfeeding should be initiated from the 4th day. So, can you get the difference? Charak is saying first day. Sushrut Vagbhat saying 4th day. First, 4th. First, 4th. Charak is on the first day. Sushrut and Vagbhat on the 4th day. Breastfeeding should be given. But modern science is agree with the Charak. Even the first thick milk, which is called as a colostrum, colostrum, that also can be given as mentioned by the modern science and also by the Charak. Okay. Stanyapana should be continued until tooth eruption and should then gradually be withdrawn while increasing the intake of normal food like adult food, like rice and what you can say chapati, etc. Now let us see what we should give for the first 4th day. First day, chatan. Chatan is a licking. Okay. Madhu plus ghrita plus suvarna. That is called as a suvarna prashana sanskar. Pushya nakshatra. Many Vaidyas are doing this like a vaccination or immunization. Suvarna prashana sanskar. Very important topic nowadays and very popular, very money-making type of the activity. Okay, Suvarna prashana sanskar. Drops are also available, and many Vaidyas they are at their clinics they are giving on the Pushya nakshatra. Okay, so Madhu plus Ghrita plus Suvarna, that is gold. Second day, Lakshmana Siddha Sarpi. This is a typical plant. Most probably this is not available nowadays, but Lakshmana Siddha means processed, Sarpi means ghee. Medicated ghee should be given. On the third day, Lakshmana Siddha Sarpi, the same. And 4th day morning, Navanita, that is like a butter, or grita. Grita means ghee. Afternoon navanita or ghee, and after the stanyapan, after that, after this period, stanyapan should be initiated. This is mentioned by Sushrut and Vagbhat, not by Charak. Okay. Now we will go further. Contraindications for stanyapan. That means when we should not give the breast feeding. Stanyapan should not be done if the mother is having problem. Which problem? For example, Shudha. She is very much, what you can say, the malnourished and very, very hungry. So in that case, her milk will not be of that much quality. But that was the say from the Samhita Granthas. I think nowadays the concept has little bit changed. Shok, yes, if the mother is not in a mood having the positivity, then that will affect the child's health. Shok is like grief or the worry or the tension. Then manasika vikar, if the mother is suffering from schizophrenia or any bad mental disturbances, depression, or what you can say the mania, then that can be the affect the child's health. Then shrama, very, very exhaustive. Then pradushta dhatu, her rasa rakta mouse made, if it is a rasadushti, raktadushti, mausadushti, then that breast milk should be little bit given with care. I will not say it should not be given, but should be given with little bit care. Then jvara, if she is suffering from high fever, yes, on that particular day, one cannot give the milk to the child. Then karsha, weight loss, maybe because of the tuberculosis or cancer or HIV. In that case also, the breast milk may be avoided. Then sthaulya, but these are not absolute contraindication. Yes, in these conditions also, the Vaidya, expert Vaidya, can ask mother to give the milk to the child, but there are some other remedies that we can advise. Okay. Also, so these are not, please write down, these are not absolute contraindication. That means, no, 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 no. It is not like that. Be careful. Be careful in these conditions. Okay. Also, it should be avoided when mother is pregnant, has consumed vidahi or the viruddha ahar. I think this is also something very funny thing, but because immediately after delivery, the lady cannot be pregnant. But some, that means they want to say something odd things. If it is suffering, then better one should take the care. Consumed vidahi or viruddhar. You have heard about viruddhar, that is incompatible food, like milk and fruits, common example. Very common example from years together. Let us give that example. Banana and milk, then sour fruits and the milk shake. That is viruddha according to Ayurveda. Vidahi, irritating. Ingested medicines, that means who is taking a lot of medicine, then breast milk should be given with precaution. If stanyapan is done in these conditions, the breast milk can cause diseases in the baby. That is why I am saying these are the conditions where the Vaidya and the family member should take care, little bit more care. Some extra medicine should be given to the mother. Care should be taken. One day halt and again start milk, etc. It is not like that she should not give the breast milk to the child. Now we will discuss about modern aspect. I'm sorry. So here are the modern aspects. Exclusive breastfeeding. Nothing other than colostrum, that is the first day milk, very thick and yellow colored. It's like a paste, but that is a part of the milk. Colostrum, because it having a lot of immunoglobulins. Immunoglobulins. This is colostrum is supposed to be the best for immunity booster in the child. So modern pediatricians, modern gynecologists, they say colostrum should be given. Colostrum should be given to the child. But in Ayurveda, there is a difference of opinion. Even the examiner will ask you, what is your opinion? Then you can say this, that Charak has advised, give breast milk from the first day. Sushrut and Vagbhat said from the fourth day. So this is the point of research, etc. Because Ayurvedic, some Vaidyas, they believe that this colostrum is heavy to digest for that baby. So some people will say only give the suvarna, ghee, honey, etc. Or some this type of the Lakshmana type of the vanaspati. But I think nowadays colostrum is normally given from the first day the breast milk is given to the child. So is recommended by WHO, World Health Organization, up to 6th month of age with continued breastfeeding along with the appropriate contemporary foods, as I have told you, rice, chapati, dal, etc., up to the 2 years of age or beyond. Next, recommendations of WHO and UNICEF. We will try to concentrate over here. Initiation of breastfeeding within the first hour of life, but if it is a cesarean section, that is taking the child by cutting the abdomen, cesarean section, very important in gynecology. A long answer question is asked, LAQ, describe cesarean section, how it is done, when it is done, indications, contraindications. So in case of cesarean section, it may be after 5 hours of delivery. Remember this thing. Normal delivery, first hour of life. But if cesarean section, after 5 hours of life, breastfeeding can be started. The infant should only receive colostrum and breast milk without any additional food or drink, not even water. No other food or fluid should be given to the infant below 6 months of age unless medically indicated. Can you see how very specific? Only and only breast milk, not even other things, water and all these things. Breastfeeding on demand. The baby should be breastfed as often as, whenever the baby feels that he or she is hungry, the mother should give it. Throughout the day and night, this is called as a demand feeding. This particular word is a demand from the child. He or she will start crying. And when the breastfeeding starts, he will stop the crying. That indicates he has a lot of hunger. Okay? No use of the bottles. Modern pediatrician and gynecologists, they strongly oppose to use of bottles, teats or the pacifiers. No, only breast milk. Now, time schedule. Time schedule. Demand feeding is advisable schedule. That means whenever the child is hungry, the following should be considered as the approximate time period. One feed per 3 hours for first 24 hours. That means after delivery, first day, every 3 hours, the mother should feed the child. Then one feed per 4 hours by the end of 1 week. After completing the 1 week, you can increase the time period every after 4 hours. First, every after 3 hours. Now, every after 4 hours. Night feeds are also necessary, remember, to avoid long intervals between feeds. So, mother has to feed the child even at night. Okay? We will go further. Breast milk. We are talking about breast milk. Initial feeding, 5 to 10 minutes at each breast. Gradually, the time on each breast should be increased so that the baby gets both fore milk and the hind milk. These are the specific terms. Each breast should be fed alternately. Okay. So for example, this time right breast, after 3 hours, the left breast, like that. Quantity, average quantity of the breast milk, 100 milli per kg per 24 hours by the third day. 150 ml per kg per 24 hours by the 10th day. So naturally you can see from 100 to going to the 150. So the dose has been increased. Okay. Now we will talk about the Stanapana Vidhi. Okay. Techniques of the breastfeeding. A woman is said to be breastfeed the baby in the following manner. How she should feed? When she is having milk in sufficient quantity and proper quality, having a pleasant mind, the mother should be happy. After taking the bath and anointing herself, very fresh. She should be always fresh. Washing the breast properly. Hygiene is most important. Otherwise, the child will get infection. Okay. Wearing the white dress. This is a Granthokta Samhita Varnana description. It is not exactly followed nowadays and not necessary also. We should understand the principles. What they are telling to you, the lady should be very happy, very pleasant. The child should feel good, looking towards the mother. That is the intention. Then in sitting posture, facing eastern direction, Purva Disha, east direction. After expressing out a little milk to begin with, should feed from the right breast first in the first feeding session. So this is the beginning. Now, if before feeding a little milk is not expressed out, the breast will become tense and over accumulated with milk. If the baby is fed on such breast milk may flow out in a gush and enter other passages, trachea. That means the child will get a huge forced milk. That is why the Samhita, Charak Kashyap, they have advised that the mother, before taking the child on the breast, she should take out some milk from the breast, so that the force will be a little bit reduced and the child will can suck it very properly. If she doesn't do that, sometimes it is possible that that force of the milk ejection will go into the trachea and the child will start cough and shwas, breathlessness and jwara and chardi, etc. So a proper care should be taken while feeding the child. Next is a stana sampat. Stana sampat, stana means breast, are the breasts which have excellent qualities. Such breasts are also considered to be a factor for successful breastfeeding. Asampata stana, not properly developed stana or improper breast, can cause ill effects on the baby. Now, characteristics of the breast and effects on the baby. Too highly situated than normal position. What will happen if the child going on sucking this particular breast? Deformity of teeth and eyes, unpleasant appearance of face. I am very sorry, my dear friends. This part is again a part of research. Nobody has done the research on this. This is only Samhita description. But as a Ayurveda student, we should have the respect on the Samhita and we should try to remember and we should try to write it in the examination. But ideally, personally, Dr. Deshpande feels that this topic should be taken by the MD students who are doing Kaumarbhritya MD or the Balrog MD. Okay. If the breasts are too elongated, obstruction to the expiration and may cause the death. I think this is a very absurd. I don't understand what is elongated and what is the obstruction. I don't understand. It may be a little bit uncomfortable while sucking. That I can understand. Then bulky. Then the effects on the baby, they are saying. Effects on the baby. These are the effects on baby. Again, this is a type of totally research. I personally don't agree with all these concepts. Very frankly. Those who are listening my lecture, they can discuss with their respective teachers in the colleges. Please, my hand folded is a request. I'm not giving you any order, or I'm not that much egoistic and whimsical. But let your teachers should also express their views, and you can write it down in my comments. Sir, I am in such XYZ college. My name is XYZ, and my teacher is saying that this is the explanation for these things. Because some topics are definitely not very clear considering the today's era or the today's way. Now, let us start with the next technique of the breastfeeding. Successful breastfeeding is depend upon many factors related to the position, for example, attachment of the baby to the breast, okay, and then psychological status of the mother and experience. So all these things matter. That is very correct. That is very easy to understand. Now, the guidelines for breastfeeding, we will see the guidelines. What are that? Mother should wash her hand before feeding because she has to express the earlier before the initial breast milk, because it should not be too much force. So hand cleaning is very much. Wash breast at least once in a day with the cloth, wet cloth. Very sterile, and sterilization is important. Repeated washing of nipples is to be avoided because that can make some ulcers. So repeated friction should be avoided. Both mother and baby should be in a comfortable position. Now let us see the pictures. Very carefully you can see the picture because it is in the oral. They can ask you these positions. For example, this is called as a cradle position. CRADLE, cradle position. I request, I will wait for every time and you have to write down these positions, breastfeeding positions. Breastfeeding positions. Number one, please write down CRADLE, cradle position. CRADLE, cradle position. Then next, cross cradle position. Cross cradle position. Cross cradle position. The next, you can see the movement of the hand here. This is the head of the baby. Okay, this is also the head of the baby. You can see over here, and these are the two hands here, only supporting by one hand. So this is a cradle, cross cradle, and this is football. Can you see football hold? This is the head of the baby. The next is a laid back position. Laid back position. And then last is a side lying position on one side. This is the head of the baby. Side lying position. Just as a matter of by chance oral, some teacher may ask you, tell me some position. The attachment of the baby to the mother's breast will be optimum in the above shown positions, and both the mother and baby will be comfortable. Why these positions are given? Because the proper feeding can be done and both will be in a comfortable position. Proper attachment to the breast is such that enough areola, this word is important, please write down in the notebook, enough areola is inside the baby's mouth. Areola. Areola should be inside the baby's mouth so that the baby can express the milk from the lactiferous sinuses. Lactiferous sinuses with the tongue. It can take the milk from the lactiferous. Lactation is a milk, lactiferous sinuses. And the child is taking with the tongue. Next. Now, how you can identify that the child is very well attachment to the breast? Baby's mouth will be wide open with the tongue over the lower gums. There will be more of the areola. This word is important. Please write down in the notebook. Areola visible above than below the mouth. So detail is not necessary for you in examination. Baby's chin is touching the breast firmly. The lower lip will be rolled down and the nose will be free. This is important. Nose should be free. Baby will take slow, deep sucks with occasional pause. Intermittently, naturally, for breathing, it will little bit take pause. No pain will be felt by the mother. This sentence is important. No pain will be felt by the mother. This is very important. So 2 or 3 words. I am always saying that students should try to take or write down, to make a habit of writing the keywords. K-E-Y. K-E-Y. Keywords means very, very important words from that particular para. This means that if you are not writing those words in the examination, you are not having good studies. But if you write down everything and with these words, then the answer is 100% perfect. So keywords are the words which should be written in the examination. If you write down all the things and if you don't write about areola, if you don't write about the mother's pain, no use of writing anything. So some keywords are very important. Next, we will talk about some problem that is called as a burping. Not problem exactly, it's a solution rather. Please write down this word, it's very important. Burping, B-U-R-P-I-N-G. Burping. Burping. This is very important technique that every mother should learn from the doctor. How to make a burping, removing the gas from the baby's stomach. Let us see. It is the technique by which the baby is held upright. Like for example, this is baby. I am holding this. Upright. Head and the legs are like not like this. Upright. Not like this. Upright. Are you getting my point? Upright. That is the most important. So upright with the chest or abdomen against the shoulder of the mother or caretaker, and the back, the baby's back is gently patted. Baby, this is baby, this is baby, this is baby. I am holding like this, and this is the back. I am gently patted until the baby belches out excess air. Oops, oops, like belching. The child should give or create that particular belching so that there will not be any gas in the stomach of the baby, and baby will not get any abdominal pain because of the gas. Because this is a common finding, the more over times the child or baby cry, the whole day it is crying or screaming because it has a lot of discomfort in the abdomen, and the child cannot tell to the mother that I am having the pain in abdomen, only crying and crying and crying. The parents don't understand why he's crying, because they are not following this method of burping. Every after feed, like in the adult, you know that particular, this is a typical Marathi or traditional word, Shatapavali. Please write down, Shatapavali. 100 feet walking, 100 not meter, only our steps, 100 steps walking after every lunch or dinner. This is for adult, that is I am talking for adult. So adult we get the Shatapavali. Can we say burping means digestion of food as it means complete of digestion of the food? No, 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 no. No, 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 no. Is not completing of digestion. Never. How the digestion can be completed in there is one question from a student that he is asking whether burping indicates the digestion of food. I say no. Because immediately after feeding, we are taking the child like this to take out whatsoever that has engulfed some gases, that has to be removed like oops. But burping is not digestion. It is not digestion. No, no. Because digestion take at least 1, 2, 3 hours. It is not possible to digest immediately. Are you getting my point? So burping is something different. Burping is removing the gas from the stomach of the baby. And to avoid, why we are doing that? To avoid the pain in abdomen and crying of the baby. Simple thing. So every after feed, immediately make it upright and just tapping on the back like that. So the child will, gas will come out. Okay. But it is not completion of digestion. Please mind, this is done after feeding to push the air. See, gas, air, push the air out of stomach of the baby, which is swallowed during the act of sucking. While doing the breast milk suckling, that child is little bit taking air also, and that air we have to remove by this particular technique. Burping is a technique, remember, after each feed, after every breastfeed. Okay, now we will talk about advantage of the breastfeeding. First we will see what are the benefits for the mother. This breastfeeding is convenient because there is no need of any special preparation to feed. Because if by chance the pregnant woman don't get the breast milk, that is a big problem, because then she has to depend on the bottle, and then the bottle, sterilization, boiling, lot of things, nipple changing, infection, child is become feverish, all problems are there. So breastfeeding, no any external support is needed. Okay, cheaper than the artificial milk. If you bring the any ready-made Cerelac and all these preparations from the market for feeding, they are too much costly. Breast milk, free of cost, free of cost. Faster maternal recovery after delivery. There is a lot of weakness to the mother, but that weakness will be regained, or uterus will go back to its original position when the mother is giving the breastfeed. Remember this thing. So faster maternal means mother recovery and involution of uterus. This word is most important. Keyword. Please write down. Best benefit. Please write down. I will make the cursor here. I will wait. Involution of uterus. Involution of uterus. Going back uterus to its normal position is called as involution of uterus after delivery. This is most important. Next, regain the figure faster. There is a misunderstanding in the ladies that if we do the breastfeeding, my figure will be problem. That is not the case. Rather, figure is maintained by the breastfeeding due to utilization of fat deposited during the pregnancy. Fat is utilized. So convince to all the ladies, pregnant women, all the mothers, that breastfeeding is not a problem for your health, problem for your beauty, but rather it will increase your beauty and you can prevent the obesity after delivery. Because many ladies, they become the overweight after delivery. So that can be prevented by breastfeeding. Yes, it is possible. Less risk of the breast and ovarian cancer, the most important benefit. I will make the cursor there and please write down. Because of the breastfeeding, breast cancer can be prevented. Ovarian cancer can be prevented. This has already been, research has been done. So this is, breastfeeding is the best. Remember this thing. Less risk of osteoporosis in the later life period. When that pregnant mother will little bit old, 40 plus, 50 plus, then the calcium will be less in the body. Osteoporosis, bone density will be less. But if she do the breastfeeding, she will not get the backache in the old age. No problem. Menopause, no problem. So breastfeeding is the best. Okay. Lesser postpartum depression, mental. Many ladies, they get some little bit anxiety and tension after the delivery, but that will not come if she do the breastfeeding. So breastfeeding has a multiple benefits, and these you must write in your examination because they are very easy to remember and easy to understand. Now, breastfeeding is not only best for the mother, but it is best for the child also, baby also, maybe male or maybe female. Best natural food having ideal composition of protein, carbohydrate, fat for the infants, which is easy for digestion and absorption and provide the proper growth and proper development of the baby. Okay, available. No going to the mother, parents, they should not rush to the shops to bring the artificial milk powders. No, this is available with the mother 24 hours a day, 24 by 7 by whatever months. Reduces the mortality rate. The child can grow very nicely and he will not or she will not die. So mortality means death rate is avoided. Lesser chances of becoming overweight or obese. The child, we are talking now about child. Child will not be overweight. But if you feed artificial feeding or external milk powders, then that can create digestive problems, obesity problem in the adulthood, not immediately. Okay. Then lesser risk of allergic disorders. Again, from the external artificial milk powders, they can create sometimes allergy, like loose motions or diarrhea or rash or the fever. These are allergic reactions. Lesser nutritional deficiency. If the breastfeeding is there, no protein deficiency, no carbohydrate deficiency, no fat deficiency, no B complex and vitamin C and D deficiency, no iron and copper and manganese deficiency, no deficiency, no. All the proximal principle of foods will be best available with the breast milk. Then protection against infections. How? So it is how it is protected from infection, because the child will get excellent immunity, best immunity with this breastfeeding, stanya. And that is why, because of the nice immunity, he will not feel ill at any time. No fever, no diarrhea, no cough, no tuberculosis, no mumps, no measles, nothing. Okay. Then better motor and cognitive development, brain. Brain, there is always two parts, sensory part and motor parts. sensory system and motor system. So both will be excellent. Intelligence will develop very good way. Then better configuration of jaw, all these bones, because of these movements of sucking and all this thing, whole this structure structurally will be very, very solid, because a good exercise for the child over here. Then less dental caries. Whenever the dentition occurs, there will not be any carious tooth, because already gums and tooth roots are very strong with a lot of good magnesium and calcium and zinc. Okay, lesser risk of cancer to the baby. Now we are talking about baby. No risk of the cancer, because immunity will be always good in the life. Now we will go further. Okay, stanyotpatti and stanya pravrutti. This is Ayurvedic aspect. Stanya word. Okay, according to the Acharya, A means Acharya Sushruta, during pregnancy, Artava, that is menstrual fluid. I think you should not get confused, because in Ayurveda, many times these Raja and Artava words are using as a substitute. Maybe sometimes they are not proper. Maybe they are not proper, but they are using alternately. Artha for Raja, Raja for Artha. Don't get confused. Never get confused. We have some basic ideas in our mind. Raja is a menstrual cycle, and Artava is like a female gamete or the ovum. That is permanent. But this, you will, sir, here Artava is a menstrual fluid. Yes, that's what I am saying. Sometimes the words are intermingled or replaced for each other by many, many acharyas. In Charak, in Sushrut, in Vak, but don't worry, be happy with fixed concept. Okay, so during pregnancy, Artho means menstrual fluid. Here he is talking about Sushruta is obstructed or not, because menses stopped. You know that whenever the pregnancy occurs, menses stops. Monthly cycle, monthly bleeding, no, goes towards, because all these things, this is an Ayurvedic language. Don't compare with the modern Ayurvedic language. They say that this is utilized for these hormonal changes for formation of placenta, apara, and also it is utilized that hormonal changes to form the breast milk. So what Sushrut wants to tell you, that during pregnancy there are some hormonal changes. This is the basic thing, although it is not mentioned like that, but whatever inside, reading in between two lines, how we should understand Ayurvedic concept with the modern understanding. Ayurvedic concept with modern understanding, that I am telling you. Sushrut wants to tell you there are hormonal changes by which menstrual cycle stops, placenta develops, and gradually, because of the different hormones, breast milk or breast starts developing. Okay, so these are the hormonal things that the Sushrut has explained in another language. According to Acharya Charak, stanya is formed as a byproduct of rasadhatu. So Charak wants to tell you that development of the breast milk depends on the first rasadhatu. And you know that rasadhatu depends on the proper digestion of the food. Proper digestion of the food, primary digestion. Amashaya, then the grahani and the pakvashaya. Sara, kitta, vibhajana is there. Nutritive parts are taken by the blood. So Ayurveda says that for getting the proper breast milk, the lady, the pregnant woman, should have the proper digestion and proper formation of first rasadhatu, which is a liquid in nature. And to get the good rasadhatu, the lady should take the liquid or the beverages in adequate quantity. This is the, what you can say, the message from that particular description. Rasadhatu is a drava anusari, liquid in nature. So during the pregnancy, after the pregnancy, enough amount of water, milk, basically milk, samanya vishesh siddhanta, because breast milk means milk. So when the pregnant lady, during pregnancy, after pregnancy, if that mother drinks a lot of milk, then she will get the breast milk. That is samanya vishesh siddhanta. So beverages, that means the fruit juices also she can consume, lot of fruit juices, pomegranate juice. So all these things she can do. Then the buttermilk she can consume. Milk is a basic thing. So this is a byproduct of rasadhatu. Rasadhatu is circulated all over the body from the Hridaya by Vyana Vayu. Vyana Vayu is in the heart and circulation is dependent on the Vyana Vayu. When Rasadhatu enters the stana, Madhura Rasa of Rasadhatu forms the stanya, that is the breast milk. So, in short, Charak wants to tell the relation of the breast milk with the Rasadhatu, and Rasadhatu qualities depend on the proper digestion. And Rasadhatu qualities depend on the proper intake of liquid food. Remember, especially water and the milk. According to the Vagbhat, Ashtangruday, Artavava Srotasa constrict immediately after delivery due to the excessive vata. This is only Ayurvedic language. But meaning is the same. Meaning is the Sushrut or Vagbhat wants to tell you about hormonal changes because of the pregnancy, which causes the opening of Stanyava Srotasa and Stanyava Dhamani, development of breast. That depends on the two hormones. First is oxytocin, that is the ejection, and the development is also depend on some particular another hormone. Okay, let us go further. We will talk about Stanya Pravrutti. The causes for Stanya Pravrutti, that is milk ejection, which is the duty of which hormone? Oxytocin. Please write down this word. OXY. Oxytocin. Ejection of milk depends on oxytocin. Okay. And oxytocin is the hormone from posterior pituitary gland. Posterior pituitary gland. And there is called as a, especially I will explain 2 or 3 words. Please write down immediately. This suckling reflex, please write down SUCKLING. Suckling reflex is a positive feedback mechanism. Please write down positive feedback mechanism, because there are 2 mechanisms regarding hormones. One is a negative feedback and one is a positive feedback. What is meant by positive feedback? That whenever the child suck it, more milk is coming. Again suck it, more milk is coming. So this particular positivity is called as a positive feedback. When the child has enough milk, then he or she, that baby, stops suckling, the child comes aside from the nipple, automatically that secretion stops. So this is positive feedback mechanism. Okay. The causes of milk ejection according to Ayurveda, number 1, of course, they are agreed by modern science. Apatya sansparsha, physical contact with the newborn baby. Then darshana, sight of the baby. Smarana, thought of the baby. And grahana, holding the baby, like that. Okay. So all these factors make hormonal changes in the mother and starts that oxytocin secretion. Due to these factors, stanya gets ejected from the breast of a woman, that is mother, in the same way as shukra gets ejaculated from the body of a man during the intercourse. As the shukra is ejected, similarly here in mother, during the suckling reflex, the milk is ejected. That is description of the Samhita Granthas. Constant affection towards the baby, love, attraction, affection, is said to be the main reason for maintenance of the lactation. Mother is also enjoying to feed the child, and that enjoyment creates more happiness in the mind, and more happiness creates the more oxytocin and more secretion of the breast milk. Okay. Next topic is Stanya Sampat and the examination. Okay. The qualities of pure or the normal breast milk are assessed based on its physical features or its effects on the child. 2 things, 2 parameters are there. One, we have to look the breast milk, taking into the glass, taking into the specific examination bottle, and see the color and all this, Lakshana. When this is most important pariksha, will you please write down? When drop in water, please write down. Please write down, my dear friends. I am telling the word in 3 times about the Stanya Pariksha according to Ayurveda. Stanya Pariksha according to Ayurveda. Number 1. That means number 1 means the 3 times I am saying. Jala Nimajjana Pariksha. Jala Nimajjana Pariksha. Jala Nimajjana pariksha. Jala, water. Take the beaker, take the water, take the in a dropper breast milk, put that breast milk drop onto the water, into the water. Nimajjana, breast milk by the dropper, put it in the water. Jala Nimajjana Pariksha. Jala Nimajjana Pariksha. Jala means water, Nimajjan means dropper. Put the drop of the milk, drop of the breast milk in the water and see what happens. Here is the result. Here is the result. When dropped one drop of the milk in the beaker water, stanya mix uniformly, homogeneous mixture. Milk and water mixed very nicely. If there is a problem, if there is a pathology, if there is a vikruti, if there is an abnormality in the breast milk, it can become a clot, it can become thread, and all these problems will occur when we put the breast milk drop in the water. Jala Nimajjana Pariksha, this word is very important. Keyword, okay? Stanya mixes uniformly. Color white like the shank. Neither frothy bubbles nor sticky, does not form any threads. That's what I have mentioned. Cold to touch breast milk. Clear without sedimentation. No vitiation of dosha. There will not be vata indication, pitta indication, kapha. No. Normal color, normal smell, normal taste, and normal touch. Okay. Next is a prabhav. What are the effect of this nice, best, normal breast milk? Normal growth and development are observed in the baby. Arogya will be there. The child will be always happy, contented, laughing, and healthy. Baby will be always healthy. Bala, normal sitting, crawling, standing, proper age, proper time, proper month. So Bala, strong. Then Susattva, bearing capacity of any stress, like pain. He will not be always crying child, happy child. Then Agni Vardhan, always hungry, interested in breastfeed. Okay, so hungry will be there. Effect on the baby. Then Sroto Vishuddhi, all the Srotosas will be clean. How we can understand, sir? Srotosas are clean. Respiration proper. Pranava Srotas. Digestion proper. Annava Srotas. No excessive thirst. Udakava Srotas is normal. Skin is very nice. Rasava Srotas normal. No anemia. Raktava Srotas normal. That is called as a Sroto Shuddhi. Functions and the quality of each Srotasa will be perfect. Then Vrishya, reproductive. So in the baby, newborn baby, sir, what is that Vrishya? Shukra? No, no, my dear friends, this is related with your age. This is related with your immunity. So they are saying the baby's immunity will be good. Vrishya means not related anything with the sex or Shukra Dhatu. Here, Vrishya means immunity is the best. Oja will be better with the breast milk. Then, Tri Dosha Shamana. All the Vata Pitta Kapha will be Samadoshaha Samagnishcha Samadhatu Malakriya. Prasanna Atma Indriya Manaha Swasthiti Abhidyate because of the breast milk. Okay. And Rupavan, color and complexion will be very nice. Okay. Next, we will go a little bit further. Naryastu Madhuram Stanyam Kashaya Anurasam Himam. Thanda, 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 cool, cool, Himam. Nastyascha Upata Nashcha Yaha Tanayoho Patyam Jivanam Laghudipanam. Sushru Sutrasthan. According to Sushrut, Nari Kshira. Nari means female, mother, Nari. Kshira, breast milk, is the breast milk which is Madhura, sweet in taste. Kashaya is Anuras, after taste. Hima, cooling effect, and Laghu, easy to digest. Vathyakara, best for feeding. Jivaniya, longevity and quality of life will be better. Deepaniya, Agni will be, metabolic process will be strong. Good for Nasya Karma also. Breast milk can be used in Panchakarma. It is not related with the baby. Nasya Karma and Netra Tarpana. It can be used, breast milk also can be used in different Panchakarma allied procedures. Next. Charat Sutrasthan, what he is talking about? breast milk. This is the last sloka of today. Let us concentrate. Charak Sutrasthan, 27th chapter. Jeevanam bruhanam satnyam snehanam manusham payaha. Jeevanam bruhanam satnyam snehanam manusham payaha navanam rakta pitte chatarpanam cha akshishulinam. If possible, try to learn this shloka by heart. पाठ करून टाका हा श्लोक याद करने की कोशिश कीजिए. According to चरक, मानुषपय. Here Sushruta used the nari kshira. Can you see the different words? Same, breastfeed. Here manushapaya means, again, manusha means male is not getting the milk, so female is getting the milk. So manusha means human breast milk. Okay, is jivaniya, making the good quality of life. Brihaniya, that mouse dhatu, med dhatu will increase properly. Satnya, no problem, no allergy. Snehana, lubricating, good for navana karma in case of rakta pitta, bleeding disorders that can be taken. Then good for tarpana karma in case of akshi shul. Especially nowadays we are getting asthenopia. Can you write down? ASTHENOPI. Asthenopia. Asthenopia is a tiredness of the eyes. Thakavat, tiredness of the eyes, because screen time is more. Screen time, SCREEN. Screen. We are always busy with our eyes for the nearly 12 hours. Either we are looking toward mobile or the laptop or the computer, desktop or the televisions, Netflix. All the times our eyes are tired because of the long, lengthy screen time. So these words should be knowing, and that particular breast milk can be made useful for the asthenopia as a netra tarpana. You have to give the oilation with this milk. Okay. So my dear friends, in short, we will go back again in a reverse order, and what we have seen today, we have seen the stanya sampata, which is the best breast milk and how it can be examined, jala nimajjana pariksha. Then before that, we have talked about stanya pravrutti, how it is coming, positive feedback, I have suckling reflex. Then stanyotpatti, how it has been coming, hormonal changes are there during the pregnancy. And then we talked about the benefits of the breastfeeding to the mother and to the child. Then we have talked about the different things, how the positions of the breastfeeding, like for example, cradle position, cross cradle, football, and laid back, and the side positions. Then we also talk about the techniques of the breastfeeding. Then stana sampat, that is, we are talking about breast. Then stanapana vidhi, techniques of the breastfeeding. Then we have seen the basic things about the modern aspect of this breastfeed. What is the normal quantity and how much should be the feeding time and duration, all that we have seen. Then we have seen the first 4th day. Charak is saying you can give first day, Sushruta and Vagbhat, they are saying 4th day you can start. So in short, my dear friends, on the 1st of November 2023, Dr. Deshpande has taken the class of Kaumarbhritya Tantra, where he has discussed Navajat Shishu Poshan or infant feeding. Thank you very much. We will see on the Sunday for the 2 classes in the morning, 11:15 to 12:15 regarding the Swastha Vritta, and in the afternoon 3 to 4, that is regarding the Charaka Uttarardha. Thank you very much. Good night and take care.